For many years, there's been a gap in our treatment options for obese patients. On one end of the spectrum, there's diet and lifestyle, which we counsel everyone on, regardless of whether they use medications or surgery for weight loss. At the other end of the spectrum is weight loss surgery. But there was really not much in between by way of medications. In addition to that, we've had some historical issues with weight loss medication in that there was this fen-phen fiasco, for example, where people were actually being harmed by weight loss medication. Fortunately, the landscape has changed somewhat in the last several years, and we do have at our disposal more medications to help treat patients with obesity. There are several different classes of weight loss medications, and for the most part, they either affect neurotransmitters in the brain that affect hunger cues, or they affect gut hormones that are released and signal the brain. Invariably, all medications have side effects, and that's an important issue. Some of the medications are stimulating or stimulatory. So side effects can include agitation, anxiety, insomnia, rises in blood pressure. Usually these side effects are self-limiting, meaning that for the most part, people feel them at the outset for several days, and then they kind of mitigate over time. Thirst, headaches, those are common side effects of weight loss medications, really of all medications. The other issue is that there are contraindications. So if you have a patient who has known heart disease, which is a known comorbidity of obesity, you can't give them a stimulatory medication that can make their heart rate go up or their blood pressure to go up. So there are a lot of considerations in how you prescribe these medications, but in an individual who is motivated, who's engaging in the lifestyle change, and who needs a tool, they can be very effective in giving them that extra little bit of help that they need to start to reduce their calorie intake and lose weight. Patients that I can think of on a first name basis talking to you that have lost 50, 60, 80, 100 pounds of weight over the course of 6 months, a year, 2 years, and who are effectively keeping it off. Is it a struggle? Absolutely. But at the end of the day, they're successful in achieving not only that 5 to 10% weight loss that we talked about, but a significant amount of weight that as a result has caused them to get off blood pressure medication, get off diabetes medication, or at least reduce it to some degree. I've had patients who have been able to conceive as a result of weight loss. So the cornerstone of any treatment plan for obesity is lifestyle modification. That includes diet, that includes exercise, and behavioral change. And really that is the core. Regardless of whether you use medications for weight loss, you move on to have weight loss surgery, that core lifestyle change needs to occur. So in my regular practice, I spend a lot of time counseling patients on dietary and lifestyle changes. And typically we have goals that are prescribed, just as the medications are prescribed, that we try and achieve on a visit-to-visit basis. And when they are unable to achieve their goal through diet, exercise, lifestyle modification, then we can add medications to help them adhere to those dietary and lifestyle changes. It used to be that we prescribe medications for short-term use, but there's been a shift now in which the guidelines state that we should use medication lifelong because you're treating a disease that is chronic, and individuals are only going to benefit from that medication while they're on that medication, just like they're only going to benefit from blood pressure medication while they're on that medication. If they wish to come off or to taper the medication, we try. Sometimes we're successful in maintaining weight without medications, and sometimes we're not. I like to bring this issue or topic of surgery up early in the game so that everyone is aware that it is an option at some point, should it be necessary. When a patient engages in the non-surgical treatment plan, They may come to a point where it's clear 6 months down the line, for example, that they're not achieving successful weight loss. Or they've achieved successful weight loss and they've had significant regain. We know that weight loss surgery is an important treatment option. We know that many people achieve significant health benefits from weight loss surgery. I find it's refreshing to them to know that this is an option that a medical doctor is discussing with them, because there are physicians out there who have opinions about treating obese patients or treating patients with surgery. This is not an opinion, it's a treatment. And as a physician, I think we're compelled to educate our patients on all the treatment options that are available.